Did you know that what we understood about facial fillers 10 years ago has been completely transformed by new scientific discoveries? Welcome to The Aesthetic Doctor, the podcast where we separate fact from fiction in aesthetic medicine. I'm your host, and today we're joined by Dr. Rogier Meulenaar, one of the Netherlands' leading aesthetic physicians who's been at the forefront of these developments for over 15 years. Dr. Meulenaar, you've said that many of your patients are surprised when they learn how differently we approach injectable treatments today compared to just a few years ago. Can you explain what's changed?
The biggest shift has been moving from thinking about injectables as simple filling agents to understanding them as tools for comprehensive facial enhancement. We now know that these products interact with tissues in complex ways, and their effects can be quite long lasting. This has completely changed how we approach treatment planning.
That's fascinating. How has this new understanding influenced your treatment approach?
We've moved away from the old paradigm of simply filling wrinkles to a more sophisticated approach that considers multiple tissue layers. For example, when we treat the midface, we're not just thinking about volume, we're considering structural support, tissue integration, and long-term changes. This requires combining different products and techniques to achieve natural, lasting results.
Can you explain more about this layering approach?
Certainly. Think of the face as having multiple layers, each requiring different treatment approaches. We might use firmer products deep near the bone for structural support, softer products in the mid layers for volume, and very fine products superficially for skin quality. It's like creating a symphony. Each element plays its part in the overall result.
You mentioned this layering approach. How does this differ from how treatments were done in the past?
In the past, practitioners often took what I call a spot treating approach, seeing a wrinkle and filling it, seeing a hollow and volumizing it, but we now understand that this can lead to an unnatural appearance over time. Today, we look at facial aging as a complex process involving multiple tissue layers. For instance, when treating the midface, we consider bone loss, fat pad descent, ligament laxity, and skin quality, all of which require different approaches.
That sounds much more comprehensive. How do you determine which approach to use for each patient?
Every face tells its own unique story, and that's why we take time to truly understand each patient's facial structure and aging process. Let me give you a practical example. When someone comes to us concerned about their midface area, we don't just look at the surface, we examine how their bone structure has changed over time, how their facial tissues have shifted, and how their skin quality has evolved. We also have an in depth conversation about their lifestyle and what they hope to achieve. Based on this comprehensive assessment, we create what I like to call a facial harmony plan. Think of it like orchestrating different instruments in a symphony. We might use stronger products to rebuild the foundation, softer ones to restore natural curves, and delicate treatments to enhance skin quality. When these different approaches work together, that's when we achieve those natural looking results that our patients love.
The article mentioned some exciting developments in regenerative medicine. What's your take on these advances?
Yes, this is one of the most exciting areas in aesthetic medicine right now, though it's important to note that we're still in the early stages of understanding its full potential. We're seeing the emergence of hybrid treatments that combine traditional fillers with biostimulatory effects. For example, newer products that not only provide immediate volume, but also stimulate collagen production. There's also promising research in exosome technology and other regenerative approaches that could help actually rejuvenate tissue rather than just filling it.
How do you evaluate these new technologies as they emerge?
We take a very measured approach. While the aesthetic industry often gets excited about the next big thing, I always tell my patients that being first isn't as important as being right. Before we introduce any new treatment in our clinic, we need to see solid scientific evidence that it works, and, more importantly, that it's safe. For instance, when a new injectable product was recently introduced with a lot of marketing buzz, we waited 6 months to evaluate the clinical studies and see real world results from other clinics. This careful approach might mean we're not always the first to offer new treatments, but our patients appreciate that we prioritize their safety and results over trending procedures. What we're really looking for is treatments that have stood up to rigorous scientific scrutiny, multiple clinical studies, clear evidence of safety over time, and a thorough understanding of exactly how the treatment works in the body. This scientific foundation is what allows us to confidently recommend treatments to our patients. It's important to remember that newer isn't always better. Sometimes it's about using existing products more intelligently rather than jumping on every new trend.
Speaking of evidence, there's been some interesting research about how fillers behave long term in the face. Can you discuss that?
Absolutely. Recent imaging studies have revealed something fascinating. Fillers can actually persist in our tissues much longer than we originally thought. Let me explain why this matters. Imagine building a use where the previous foundation is still partially there. You need to know exactly what you're working with to build safely and beautifully. This is why we use advanced imaging in our clinic. It helps us see how previous treatments have integrated with the tissues, where products have settled, and how they've influenced the facial structure over time. Sometimes we find that a patient who thinks they need more filler actually has residual product from previous treatments. They just need it repositioned or combined with other techniques for optimal results. What's particularly interesting is how differently each person's tissues respond to treatment. Some patients metabolize products quickly, while others retain them longer. Understanding these individual patterns helps us create more precise, personalized treatment plans. This knowledge has led us to be more conservative and precise with product placement, always thinking about how treatments will age with the patient.
How does this knowledge impact treatment planning for patients?
It's completely changed our approach. Instead of quick fixes, we now think of treatment as a journey we take with our patients. For example, when treating the cheek area, we typically start with conservative amounts and observe how the tissues respond. Some patients are surprised when I suggest waiting a few months between treatments, but I explain that this careful approach leads to more natural, longer lasting results. What's fascinating is how each person's tissues respond differently. We might see excellent collagen stimulation in one patient after 3 months, while another needs more time. That's why regular follow up assessments are so crucial. They allow us to fine tune our approach based on each individual's response. It's like tending a garden. You plant the seeds, nurture them carefully, and adjust your care based on how things grow. The goal is to achieve natural looking results that age well with the patient, rather than creating dramatic changes that might look out of place in a few years.
What should patients understand about this modern approach to treatments?
The key is understanding that achieving natural, lasting results requires a thoughtful, comprehensive approach. It's not about quick fixes or following trends. Patients should look for practitioners who understand both the science behind these treatments and the artistry of facial aesthetics. This combination of knowledge and skill is essential for optimal results.
And how can our listeners learn more about this approach?
We've developed an educational guide that explains our comprehensive treatment approach and how we combine different modalities for optimal results. We also offer in depth consultations where we can discuss individual needs and create personalized treatment plans based on scientific principles and proven techniques.
Thank you, Dr. Meulenaar, for these valuable insights. For our listeners who want to learn more, you can download our comprehensive guide on modern injectable treatments at website or schedule a consultation by calling number. Dr. Meulenaar, any final thoughts for our listeners?
Choose your practitioner carefully and don't be afraid to ask questions about their approach and experience. The best results come from a combination of proven techniques, scientific understanding, and artistic vision.
That's all for today's episode of The Aesthetic Doctor. Join us next week when we'll be discussing another interesting topic.